Hello everybody, we are now in the treatment room with our patient Natalia. We took the blood in the morning, it has been processed for 6 to 7 hours, 6.5 in her case, and we just filtered it. This is one part of the serum that I extracted from her, which I use manually in a syringe. This is which I use in the area around the eye because the skin there is very delicate. So this is what we're going to do first. And then I will use the mesogun for the rest of her face and also the forehead. How do you feel?
I'm okay.
Okay, as good as you can be. Okay, if you don't mind, just turn your face to the side. And we're going to start making small injections into the skin just close to your eyes. Is that okay?
Yes.
Does that feel all right? Well done. There will be a little bit of puffiness around the eyes for, let's say, 1 to 2 hours, as I'm producing small depots of NABFAB in this area. But once the tissue has absorbed all of the serum, this will disappear. How does that feel? Do you feel anything?
Yes.
Yeah? Does it hurt or is it just a little bit of a...
Just a little bit.
Okay. I'll come to the other side so that we can do the other side of your eyes. Okay. Sorry. Well done. This is the treatment for the eyes. Based on the research in Germany and also my own personal experience, using a needle and penetrating the skin as you give the product into the skin is superior to using cannulas or microneedling or dermapens. I decided to use a mesogun because this is the highest way to control the depth of injection and also the force and thereby the product volume that I'm putting into the skin. This is what we're going to use now, and I will use the gun for the cheeks, I will use the gun for the forehead and the chin and jaw area. Anything around the eyes, the skin is very delicate. This is the only area where I'm still using a meso needle and I'm doing the injections manually. Okay? So we set the depth of this now and we start with about 3 millimeters. If you turn your skin, your face to the side, thank you. Okay, I'm going to start over here, the first one, and you tell me if this is okay. How does that feel?
That's fine.
Is it fine? Okay. As you can hear, this machine works with a hydraulic press. And what I'm doing here is I'm setting small boli into the skin and we produce small depots of serum into your skin. The product is being injected into the skin as long as I am pulling the trigger. So I'm not using the mesogun in an automatic mode, I'm using it in a manual mode. This allows me to have the highest level of definition, and I reckon I can reproduce the same kind of injection every time. On an average, every patient produces about 4 to 4.5 cc per syringe that we take. I can use those 4 to 4.5 cc for a full face, but if we use the same amount for a distinct area, let's say the cheek, obviously the result will be superior as we are increasing the amount of product that has been used in one area. Usually I use 0.6 cc for around both eyes, and then depending on the preferences of the patient, we go for the cheeks, or we also take the cheeks, the jawline, and the forehead. In my personal experience, any area that we treat around the eyes is the most significant one. Why? We communicate with our eyes. So anytime we create a better skin quality around the cheek-eye complex, it has the greatest impact on the way we look. Another benefit of the Mesogun is I can adjust the penetration depth. The skin has different thicknesses across the face, and I can adjust the needle in accordance to the thickness of the skin. So we now finished the treatment of her right side of the face, and as you can see, the product immediately starts to react. You see the redness on the right side, on the right cheek. We treated the cheek, the temporal area, the jawline, and also the chin area. And as you can see, the left side is less red, just like the forehead. The plan for this patient will be, we will treat Natalia's other side and equally her forehead. However, she doesn't need a lot of product in the forehead, as it is very smooth and has good quality of skin already. Okay? So now that the treatment has been completed, there is a little bit of tenderness in the face and redness, and in order to soothe the skin and reduce this kind of feel of a too small glove around your fingers, we apply a hyaluronic acid mask. We let this rest on the face for about 5 to 10 minutes, and it just rehydrates the skin already and reduces the stress that was produced by the injections.